Hi guys, Will from Acute Physiotherapy here again. Today we're going to go through some really simple tips that can help you get through an acute lower back pain episode. Obviously at the clinic it's something that we see quite a lot, and whilst we can't be there with you right now, let's see if we can do a few things that will help you get through this very difficult time. So there's a couple of things you should do with lower back pain, and the first thing that I say to all my clients is get your pain under control. Now some of you might say, that's why I'm coming to see you, Will. But the truth is, two simple things. If your doctor allows it, or if you know that there's no reason why you can't, take regular ibuprofen, regular paracetamol. Obviously I'm not a doctor, but they are over-the-counter medications, and just doing those things regularly. The mistake I see a lot of our clients make is that they say, I took one ibuprofen, didn't do anything. The truth is, it will only work as well as it can if you take it as recommended on the box. But as you say, disclaimer, big thing, you have to check with a pharmacist or your doctor, or know that you're allowed to take it. Other things that can help with pain, really simple. Hot, cold, no real wrong or right answer here. Most people find that heat generally helps with lower back pain. So getting a hot water bottle, wrap it in a soft cushion towel, whatever. Even ice, yet again, put it in a cold, wet, damp flannel. No wrong or right answer. Do what feels good for you. It's about making you feel relaxed, taking the anxiety away, taking some of that muscle spasm, or whatever is causing the pain. So the other thing we're going to go through is a couple of simple exercises that you can do at home. This is something that we regularly give to our patients. What I can do as well, if this is something you would like, obviously the video will show the exercises, but if you'd like a little diagram, we have a printout, no charge whatsoever. Just give me an email, leave a message in the comments below, and I will get these exercises to you. But what we'll do is I'll get the video set up and I'll show you a couple of simple exercises you could do if you woke up with severe back pain, and show you how you can manage it. Okay guys, so as we talked about earlier, making sure we've got regular pain relief on board, and then using something like heat. Now this position here, we call it crook lying. So basically lying on your back, that if you have got muscle spasm, lying down flat, having your back supported, can just make those muscles relax down sometimes. Also by bending the knees up, it takes a little bit of stretch out the back. And what you could do is put your hot water bottle or your hot bean bag under there, and then simply just stay in this position. We call it a position of ease. It can take away some of the pain, especially in that first 48 hours, 72 hours of acute back pain. You don't know why you woke up with it. Just sometimes just lying down gently in this position can just sometimes calm things down, especially when you're a bit of shock, a bit worried about what's going on. Now from here, we can do a couple of things. One, really simple, is just really gentle, roll the knees from side to side. So what we're doing here is we've got the back supported, as you say, it's taking gravity out of the equation. It means those muscles, especially if it's muscle spasm, aren't having to work as hard. And then what we're doing, as you've probably heard over the last 10, 15, 20 years, is that with back pain, we never want you to stop moving, not moving, do anything like that. We want to keep things moving gently, but all within the limit of your pain. The mistake I see with some of my clients with this exercise is that they think they have to really stretch it out, and as soon as the pelvis comes off there, yeah, you're going to be putting a stretch on things that are possibly a bit sore, and maybe flare things up. So keep it really simple. Hot water bottle, heat, ice pack, whatever, and then just really gently rock the knees, nice and rhythmically, nice and smooth, and just keep that lower back moving. Another simple exercise we can do is just to bring a knee to the chest. Same thing again. It just keeps that lower back moving if you're finding it difficult to bend over at the moment. And this is a nice way to replicate that movement without having to cause any pain, working against gravity again. Another nice simple one, just sometimes you get a gentle stretch, but this is something you might build up to over a course of a few days, is just lifting up and just stretching out, especially if you're getting some buttock pain. Some of my patients with sciatica might say that they're getting down, but that might be something that you ease into. Remember, none of these exercises should make the pain worse. Okay guys, lastly, the final exercise that we sometimes recommend to our acute lower back pain patients, especially if maybe there's some what we call neural involvement, so nerve pain, sciatic pain, is yet again, we do want to keep it moving. Like we say, the evidence suggests that actually stopping still, not doing anything, actually can make things worse. So obviously, like we discussed, get pain relief on board, use heat, use any deep heat creams, deep freeze creams, but then do those exercises we showed you before. And then the final exercise is what we call a nerve glider. So what we're doing, or flossing, that's sometimes the other way we call it, is that rather than stretching the hamstrings, the sciatic nerve, which can often flare things up, actually let's just floss it. backwards and forwards, nice and smoothly. So in a nice comfortable chair, what we're going to do is very gently just literally extend the knee and bend it, and just do it backwards and forwards 20 times, nice and gently. Shouldn't be any pain. If it is, so if we get to that movement, you feel your pain, you feel the back, just relax it down and just go half the distance. Keep it moving, but don't flow it up. Always work within the limits of your pain. And yet again, like all the exercises, it might be something you build up to after 48 hours. The most important thing is get that pain relief on board, do the right things, go for a gentle walk, change position regularly, and fingers crossed we can hopefully get on top of this. If you do need any more help and advice, just leave a message down in the comments, leave a telephone number, leave your email address, we'll contact you, we'll get in touch, and we'll see if there's anything we can do to help you, even if it's just a bit of reassurance. Hopefully look forward to speaking to you if any of you guys need our help. All the best. Bye-bye.